Today on Accidental Experts with Bryce Hamilton.
Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so glad you're with us today. So we have a special guest that's going to be talking to us about parenting kids with chronic illnesses. This is a topic that has been much requested because I think that it is both hard to see people who are parenting their kids that have a chronic illness. And as somebody who doesn't have a kid with a chronic illness, we are not sure what to do. But then also it's hard to be the parent who is parenting a kid with a chronic illness. So we have Erin Hambrick, and she is a PhD in psychology, and she's going to be talking to us about this important topic. With that, let's welcome Erin.
Absolutely. I'm happy to be here.
Yeah, this is such an important topic. So we're going to be talking about parents with kids who have chronic illnesses. And I think, sometimes as a parent who is lucky enough to have healthy kids, this isn't something that we're often thinking about. And this is a huge strain on parents. I mean, parenting is hard enough. Then you add in having a kid with a chronic illness or several kids. I know some families have more than one, and this can be such a challenge.
Yeah, it absolutely can be. I think, you're already really alluding to a really important issue. And not only might a family have a kid or multiple kids with a chronic illness, it's also really common for one child to have multiple chronic illnesses, right? So sometimes these challenges hang together, especially if you're layering physical illness and mental illness together. Yeah. And there really can be a lot of isolation, because the lifestyles that these families lead can be so different from the lifestyles of other families. And it can just be hard for there to be a shared understanding, when families who have kids with chronic health issues are around families who don't. It can feel kind of stigmatizing and isolating, even when people are being as supportive as they can.
Yeah. So let's pause for a second and go back and kind of name what do we mean, like when we're saying chronic illnesses, like what kind of things come under this label?
Mm-hmm. I think if you ask 5 different people, you might get 5 different answers. But, my own conceptualization of chronic illness is an illness that, right, obviously begins in childhood, but that is something that is unlikely to go away. This is going to be something that potentially is going to require some lifelong intervention.
Yeah.
I think that years ago, we always had this really firm line between physical health and mental health. And so I think even 10 or 15 years ago, if we were trying to answer this question, we would say, well, a chronic illness is diabetes, right? It's cystic fibrosis, it's asthma, it's sickle cell anemia, right? Mm-hmm. Now, I think the conceptualization of chronic illness has expanded and now really includes mental health and neurodevelopmental challenges. Things like ADHD, right? That we know that if that's something that you are diagnosed with early in life, you are probably going to have persistent challenges with that. Autism being another one. So I think the umbrella has gotten bigger. We're not just thinking, the childhood cancers anymore and the major childhood illnesses, but there's also that neurodevelopmental piece that's falling under that umbrella, which really, when you think about it, means that depending on the statistics that you're relying on, anywhere from 18 to almost 45% of children have a chronic illness.
Wow.
Yeah.
That can be so shocking. I mean, that I don't know that I am aware of that statistic. Like, that's just such a big number. So to think about, like, lots of people are going through this. And I think, when we think about the challenges in mental health, I mean, you may have anxiety and get some coping skills and,
treatment and work with a therapist and be in a place where you're stable. But that doesn't mean that you don't still have anxiety. And so thinking about the fact that like, even though maybe that kid's ADHD looks managed, right? Or their anxiety is in a good place right now, or they have coping skills for their depression, whatever that looks like. And we're in a good place doesn't mean that we're not still navigating through this. It's still a reality for those families on a daily basis. Or if it's a physical health issue, right? Like diabetes, their diabetes looks managed and it hopefully is, but that doesn't mean that there's not a lot of moving pieces behind the scenes to keep that in that space. So what do you think are things that are not obvious that parents with kids with chronic illnesses are navigating that might be different than, you know, the other percentage of whatever we want to call those other population, right? Like the typically developing, the healthy.
I frequently say typically developing. I'm comfortable with us using that. You know, I think one thing, you know, the burden of medical visits and medication management it can be really high, and can also be a source of family conflict. It can be hard to get children to take medications and to, you know, we use the term adherence in children's hospitals. We talk a lot about adherence to treatment protocols, and adherence obviously has a really big correlation with how much better somebody is probably going to get. And so it's a huge challenge, especially when a lot of things have to be adhered to on an outpatient basis. We obviously want children out of hospitals and in their homes as frequently as possible, but that really ups the demand for the family to do the medical treatment. And so there really can be a lot of challenge in terms of getting kids to comply, especially if you're dealing with like a cystic fibrosis. I mean, some of the interventions for that are pretty invasive. You have to wear vests that break up, you know, mucus that's in the chest, and you have to do it for 20 or 30 minutes, maybe multiple times a day, depending on how exacerbated the issue is. Or right, with diabetes, we're talking about needles, we're talking about shots. Those aren't things that are easy on families. And so, you know, aside from just getting the kids to the appointments that they need to go to, making sure that they have the right health insurance coverage, making sure that when their favorite doctor moves to a new hospital, that they can still be seeing them or seeing someone who's going to do as well with them as anybody else. I think those burdens are really, really big. And depending on the age of the child, those burdens can look different. It's different trying to get a 3 or a 4-year-old to take a medication than it is trying to get an adolescent to take a medication, right? Because sometimes you get that medication hiding from adolescents, or adolescents may not like how the medication makes them feel, and so they take it at times when it's not been prescribed, those sorts of challenges. So I think that's a really big one. But I think another one is what we alluded to previously, that there is a bit of an isolation because, again, depending on the severity of the illness and how frequently the child is hospitalized, a lot of families really feel like they're living a completely different life than families who don't find themselves in hospitals all the time and talking to doctors and nurses all the time and advocating for their child's health all the time. And so I think it's almost like the parallel of when people come back from a deployment, right? If somebody goes and, you know, is overseas as part of, you know, the Army, sometimes they come back and they say, it doesn't make sense to be home, right? Because everything was so intense and important and unique in that specific context. I think that families with kids with chronic illnesses can feel that way sometimes. I think when they go back to, quote, normal life, they feel a little bit like a fish out of water. I think they feel a little bit like the things that they have to talk about are kind of downers, right? Like nobody wants to show up to all the Christmas parties and have somebody say, how's it going? And all you have to talk about is your child's chronic pain, right? Like that's what you've been doing for the past 3 to 4 weeks. So I think that's another big one.
Yeah. Well, and it's hard to get those things off your mind, right? Like, so to have these other conversations about like things that might seem trivial when you're going through something so big, when your kid's in chronic pain, or maybe you're working to manage their diabetes or anxiety, and maybe your kid's been hospitalized. And I mean, it's like, it's thinking about like what things are on sale or what you're making for dinner or whatever. It's just like, I can't even, that's not even on my mind. Like I don't even, that I don't know how to do that. So I know a lot of parents then will avoid things like that because it is so uncomfortable and they're also so exhausted. Right.
Exhausted.
So I think
unaffirming in some ways. Yeah.
Yeah. Well, and it's, I mean, so I had a small glimpse of this. I have kids in my house with ADHD, and there was a time period where we could not get the medication. And I'm like calling all of these different pharmacies to try to find the medication. Yep. And I mean, that was so exhausting. I'm like, I am working all day. I do not have time to do this. But it's like, that was just like on a small scale of what a lot of families are going through. And it's a lot of times it feels like the system's against you. Like, you know, like in some ways of like, you're a fish swimming upstream, right? Like, it's just like so challenging to do that. And then you want your kid to have a quote unquote normal life, right? Like to have friends and do activities and be connected and be at school. We know how important it is for kids to physically be at school, but sometimes that's not something we can do when our kid is going through something like a chronic illness, and then we're missing work. And, you know, it's like, you just feel like no place feels safe, feels secure, feels stable. It
feels like your place, right?
Yeah.
You know, I think two other things that are really worth pointing out in terms of differences between these families and other families is there really are a lot of missed developmental opportunities that occur for kids with chronic illnesses, you know, right? They are out of school a lot more. And sometimes that means they miss the Halloween party, right? Because that was the only time their provider could see them. You know, depending on how severe or challenging the illness is. Exactly. Children don't have time to go on play dates. They're not able to do things when they're unsupervised. And so they don't get that good peer-to-peer interaction. I've mentioned adolescence, and I'll mention them again. It can really be a time of resentment when a child with chronic illness gets to adolescence and recognizes all the things that they can't do independently that all of their peers can do, and all of the ways that their illness is holding them back from sports or extracurriculars, right? Some kids with asthma, it's not even feasible for them to play certain sports because they get too winded. Children struggling with obesity, I think, have a similar experience. They can have a similar experience when it comes to sports and other extracurriculars. So, you know, and another thing worth pointing out that's semi-related is we've talked about parent-child family dynamics, but we haven't talked about sibling family dynamics. And that's a really big one. When there is a child in a family who has a chronic illness or some sort of disability, it can be very challenging for siblings who don't have those diagnoses to know and to understand their role. And we see a lot of different presentations in the siblings. You know, one can be just downright resentment and even jealousy sometimes because this other sibling is getting so much attention, right? Like, we all know it isn't attention and it isn't parents playing favorites, but there's this pressing demand that everything in the house revolves around necessarily. And for kids who don't really quite have the abstract thought capabilities maybe yet to really kind of stand outside of that as an observer and say, oh, I get it. And it's so great that I'm healthy, right? Like all of those reasoning steps that many of us might go through. That's hard for them. And so it can really strain the sibling relationships, but also, you know, the parents don't just have strained relationships with their child who they're trying to get to take medication and to follow through with medical protocols. They're having strain with the other siblings as well, and potentially feeling a lot of guilt associated with it because they don't really know what all they can do about it.
Yeah. Well, and I'm also thinking like a strained relationship between also the parents potentially, right? Because
Yes.
having a kid with a chronic illness means, you know, you may not be able to leave your kid with a babysitter. You have to be there or have, you know, somebody that's qualified there all the time or whatever it is, or trusting that. Sometimes it's our own anxiety that keeps us from doing those things, but it definitely presents challenges there too. So I am imagining that with families that are going through this, like it probably feels like you can't win. Like,
right. And then, you know, good case scenario, there are two parents available who are trying to help and support. And within that scenario, sometimes you get a lot of parental disagreement, right? About, no, we should do this treatment path. No, I think we should do that treatment path. Or one parent's more lenient than the other with the child, right? And leniency is actually a really big issue for kids with chronic illness, because since they're going through so much, sometimes then people ratchet back other expectations, which is really not good for kids. I mean, the research is pretty clear that kids with chronic illness need the same types of expectations and boundaries as other children do, right? Because children need expectations and boundaries, and they need to know limits. And gosh, in some ways it could be more important for kids with chronic illness because maybe it provides a sense of security and normalcy that they don't feel when they're at doctor's appointments getting poked, having people talk about their health, wondering if their challenge is going to get worse, that sort of thing. So even in that kind of best case scenario where we've got two adults who are primary caregivers, there can be challenges. What we haven't talked about yet is families where there's only one caregiver available, and they have to be available around the clock. Sometimes these caregivers, depending on length of hospitalizations, say it's a childhood cancer or a cystic fibrosis type situation, I mean, they're often living for weeks at a time at like Ronald McDonald houses. And, you know, maybe they only have to do that every couple of months. But if you're the caregiver and you're doing that every couple of months, how are you working? Right? How are you doing anything else? So single parent homes are very, very challenged by this issue as well.
Yeah. Well, then I just think about like, okay, so you go with the kid that's at the hospital, but if you have more kids than just one, then you've left those kids. I can only imagine that there's a lot of guilt.
Yeah.
Right. Even if is a 2-parent household, like there's still, I know I feel guilty when I'm at work late from my kids, and that's just like every once in a while, right? Like I'm not gone for weeks at a time, but it's just like thinking about all those levels of challenge. So something you said earlier about like the other kids having resentment, maybe or jealousy. So we went through a stomach virus at our house not that long ago.
I'm so sorry. Those are my least favorite circulating viruses.
Yes. And they seem to be going around. So hopefully we've caught it and we're done with that. But weirdly, the youngest one did not get it. So that was crazy. So, but he's home more. And I don't know why he didn't get it, but I'm thankful he didn't. But then he started feeling kind of jealous that the other kids were like throwing up and like they're getting like special attention. And it was like, no, you don't want this. And he was like, yeah, I think I'm going to throw up. I'm feeling really sick. And it was just like that on a tiny level of like seeing how even just because most of the kids were home for a whole week. And so like that was a long time to be sick. It just like would not stop. But I just was thinking about like, like that was just like 1 week, right? But we're talking like weeks and weeks, and just our reality is this place. And so it's like, how do you help support that? So thinking about that piece. So we have challenges for the kids who are in it, right? Who have the chronic illness that are feeling feelings. We have potential siblings that are feeling feelings, right? Like we have also other family members. There's just a lot of pressure here.
Yeah, I agree.
That's giving me a lot of empathy for these families that are going through this.
Yes, absolutely. And, you know, again, my kind of worldview is there isn't a firm line between mental and physical health. I think they're so related. And when you have chronic health problems, you are much more likely to experience mental health challenges as well. Right? You're out of your routine. I mean, think about the things that kind of generally make us feel good. We like to be able to plan our day, have a bit of routine, feel competent that we got some work done, go to sleep on a routine schedule, ideally not take medications that might make us feel strange or have side effects. Those aren't luxuries that children with chronic illnesses have. And that can put children at risk for depression, for anxiety, for general moodiness. I mean, even just the very nature of diabetes, as an example, when your blood sugar fluctuates, it can lead to major mood challenges. I mean, even just having slight low blood sugar can make you feel short of breath and not all that clear-headed. Right. And so it can be really hard to try to look out for preventing kind of these secondary challenges that are so frequent in this population.
Yeah. So speaking of that, like what other challenges do you see that kids with chronic illnesses have that might be different than the general population?
Yeah, it's a good question. I think we've alluded to it, but just they have less time. They have a lot less time, free time to make choices. They have a lot less time for exploration. I think they feel as if they have less to connect with their peers about. I think they feel different. And I think there can be a lot of stigma that comes with that. Just, especially when you're trying to figure out who you are as a child. And then you look around and everybody else is different, and they're not really different in a way that feels like you're on the great end of things. And so, those social comparisons can just feel bad. Again, even if other children are being kind and accepting, right? It can even just be the way that kids feel when they feel eyes on them for just a little longer than people look at other people, and I see my own kids do it. My own children will see something that looks different, something that they're not accustomed to, and their eyes linger, right? And then, and we talk about it, and we talk about how maybe we don't want to, look for a long time at other people, right? But it happens. And so this is part of the reality for kids. And so those are, of course, big differences. I think they miss out on a lot of competence building opportunities because they miss out on extracurriculars, and there's so much out of school time for so many of them. And so many of them aren't hitting their full potential and can feel frustrated, right? That, I'm capable of so much more than I've been able to show.
Do you find that obviously we're looking at a huge diverse population here when we say chronic illness. So this is also a general question, but like thinking about how do you think educationally, I'm like trying to think, do you think that kids that have chronic illness get behind educationally sometimes? I
think there can be huge educational impacts, and it's hard. And I've spent a lot of time working in school mental health as well. It is hard to get systems to work together. It is very hard to tell a hospital, hey, we really want you to work with this kid's school, right? They're like, no, we've got our own daily schedule and bottom lines and things that we need to get done. Or, just the other day, I was trying to collaborate with a teacher for a child that I treat. And, she forgets to call at the appointed time, right? And you just have to be able to have a lot of flexibility when you're trying to collaborate across systems. Well, let's think about people who have very little flexibility in their jobs, nurses and teachers, right? They're like in charge of people's health all the time, or, nurses are. And then, when you're at school as a teacher, you're always front facing with kids. There are really very few moments that you're not in charge. And so getting those systems to interact and finding liaisons can be very challenging. And so things like, student advocates, people who are really kind of at the school and it's their job to look out for, the educational needs of kids who might have disabilities, chronic illnesses, mental health challenges. I think that can go a long way. But I think it's really a big next step for our kind of mental health culture here in the US, mental and physical health culture, that we can't just be isolated and say, well, this is what I do, and this is what I treat, and this is what I focus on. Mm-hmm. We have to be thinking a lot more whole person, because of course, these kids who are out of school all the time or who have additional demands on their lives because of chronic illnesses, of course, they are getting behind. And then the self-confidence dips. And when that confidence dips, so does the educational motivation. And so these are just highly related constructs. And gosh, I wish we had healthcare systems that reimbursed for that collaboration, right? That cross communication, because sadly, there are no financial incentives for stuff like that. Mm-hmm. Like, this is work that when people do it, it's often coming out of the goodness of their heart. So yeah. I don't know. We got to find like systems level solutions for this type of stuff, because just telling teachers and nurses and doctors to be better and call each other more, that's not really the solution.
Well, and excuse me, it's hard to make that happen, right? Like when you have so many things happening in front of you, it's not a lack of wanting to. I know even in my practice, at times it's hard to coordinate a call. I'm like, can I call you at 7:40 on my way into my office? Can I call you at 7:15 when I leave my office, right? Yeah. Like, those are not ideal times for anybody to be doing anything, but that's like the times that I'm not seeing people in my clinic. Yeah. And so it is really hard to coordinate. And I think, just thinking about all the levels. So with that potential for being behind, this would be a time for me to think about like IEPs or 504 plans where we have to kind of advocate. Can you speak to that a little bit?
Yeah, I mean, I think those plans can be very useful because, they at least get into place kind of legal, right? They put some like fire, or I don't know, whatever. They really motivate people to follow them because they're legal documents. That's what I'm trying to say. I think those can be great. Also, they take a lot of effort to build, to even get off the ground, right? To get the right people in the room at the right time to build the 504 and draft it up, or to, develop the IEP. And you can't even have an IEP typically until there is some sort of academic disruption already, right? So, and 504s are more for disabilities. Which, mental health and physical health challenges can certainly be classified in that way, and accommodations can be put into place. But yeah, those documents are time consuming and challenging to build out. They don't always get followed that well. And it's another place where parents end up needing to be really huge advocates for their children. So again, they can have great utility. Absolutely, because they get everybody on the same page. Literally, you have to spell out, here's what we're all going to do for the kid, and here's how we're going to know if we did it and if we provided those supports. But it is an additional layer of paperwork and advocacy. And I think it can be a hard decision for families sometimes if they want to go down that route, or if they want to keep trying to work informally with their providers to get everybody on the same page. I know in terms of, I've had a kid who I've wondered if needed to have one of those plans. And so far I've kind of just said, I don't know. I kind of know how to advocate, right? I have the privilege that I've had training in this. And so far my advocacy is working. Right. But, if it doesn't, then one summer I'll need to do the heavy lift to figure out how to get one of those drafted up. I also think I spent a long time when I did work in school-based mental health. We were trying to figure out ways to make all these what we call support plans, which would include 504s and IEPs, a lot more trauma responsive. And I think those principles really apply to kids with chronic illness, because even though a chronic illness might not be traumatic per se, it certainly cuts at a child's ability to see the world as safe and predictable, which we know is a core challenge for people who've experienced trauma. And, I don't think we're there yet collectively in terms of making these plans really child focused, making sure the language is very positive, pro-child, making sure the child's even involved in the development of those plans, and let alone the child, the family, because, sometimes the family will request one of these plans, or the school will say, hey, we need one of these in place. And even the family themselves doesn't get included to the degree that they should be included, and the follow-up timelines are poor. So, I think they're great tools, but I think, like, say if you're a mental health provider for somebody who has an IEP, I think it's really important to know you need to figure out what's in that IEP, and you need to ask the family how it's going and how the school is reacting and responding, because it's not a turnkey solution to get one of those in place.
Yeah. Well, and I think even though it's a federal mandate to follow, it's implemented by different people at different schools and in different ways. And I think there's lots of complexities to that piece. Yeah. I mean, I think we have a long way to go here, right? Like there's a lot of progress.
That's what I'm best at. So I apologize, pointing out the work that's yet to be.
Yeah, no, that's great. I mean, we have to know what still needs to be done, because I think also, sometimes as parents, we don't know what is that even affording us, right? We get an IEP, we get a 504 plan. What does it really do? And a lot of times I'll see parents who are like, yeah, we have that. And I'm like, can I see it? And they're like, I don't even know where it is. I don't have a copy of that. And, so it's like, it's hard to know. It's hard to do all the things, right? To be advocating for all the positions as a parent, because like, really, this is a job that you signed up for, most likely, but like, you did not know what you were quite getting into, depending on what challenges your own child is going through. And all of us are going to have kids who go through different challenges, whether that is a health issue or a mental health issue or just a normal development issue. I think there are always challenges. So talk to me about, what do you think parents can do to support their kids that have chronic illness?
I tend to kind of always operate and function under that trauma responsive lens. And, I always encourage parents to try to build in as much routine and predictability in the child's life as possible, because these medical appointments and these, pain events. I mean, what we really haven't even talked about is like chronic illness can hurt. It can make kids feel, I mean, we talked about it a little bit with diabetes, but it can make kids feel really, really bad. It can make them feel very sick. And that makes them feel very powerless and as if they don't have a lot of control. And so I think, to the extent possible, keeping calendars, letting kids know the daily plan, the weekly plan. You might not want to go way beyond that, especially with young kids, right? But like, this is what your treatment's going to look like this week. And wow, this is a big week of treatment, right? This isn't like all the other weeks are going to be, right? Providing some of that context. And then, getting as much built-in routine as you can around that. Maybe you even park in a similar spot every time when you go to the clinic, and you walk in and you get to know the name of the security officer, right? How there's always sometimes, officers sitting there at the front of hospitals or medical clinics, trying to help the child make relationships with their providers, so that these aren't just kind of unpleasant encounters. And so, to the extent possible, having a consistent care team, which is again why kind of toward the start of this, I alluded to how hard it is when a provider maybe changes hospitals, right? Or changes locations, because it is so good for kids to see the same doctor, to know the nursing staff that they're going to be interacting with. If they get some measure of enjoyment out of going to those appointments, it's going to make a world of difference. I love when the hospitals will have like child life teams or child life specialists that, literally go around to hospital rooms to meet kids, I'm here in Kansas City, and we had Taylor Swift in Children's Mercy Hospital last week going around and visiting kids, right? And it just kind of brings tears to your eyes because you're like, what a big win for those kids who are hospitalized at Christmas and those families, right? So I think routine, structure, relationships, I focus a lot on that. But I also tell parents they've got to focus on it for themselves too, because their emotional regulation is the greatest tool that they have when supporting their child's emotional regulation. And so if they don't fully understand that they need rest, that they need breaks, and that is not weakness, right? We see a lot of parents, they're like, I'm going to be strong for my kid, right? And I'm like, well, let's talk about what strong looks like. Strong looks like taking breaks. Strong looks like resting. Strong looks like being able to do this for the long haul. And so I think parents really need that message when they're in this situation, because you feel like you personally need to be at every single appointment. Well, maybe grandma can go, right? Because you needed to go exercise. You needed to go on a walk. And that's strength. It's not weakness. That's actually knowing and doing exactly what your kid needs.
Yeah, which is so hard to think about that, like to not be there, right? Like you want to be part of this. But I think, we're showing our kids the things that we ideally want them to do for themselves too, right? Which is to advocate for themselves, take breaks, talk about how they're feeling.
Yeah.
We also have to model that, which is super hard. And it is hard to be away for an appointment because you want to know all the things. And I know that like if somebody else takes my kid to an appointment, sometimes I don't get the information, right? So it's like that piece too of like, but I think you can also ask the provider, hey, can we get this note? Or can you, make sure like whatever we need to remember that we write down, or you make a conscious effort to write it down if you're another person who's supporting a family with a child who has a chronic illness. But I think, it's also those pieces. So what other things do you think parents can do to support themselves? Because I think, supporting our kids, like being emotionally available is important, and physically available is important, and those kind of things. But like, what else can parents do to support themselves?
I think they need people on their own care team, right? Like they do. And they need to make sure, even if they don't have actual family, blood family close by, that they do have people who they trust as if they would a family member, because there are going to be times when somebody else is going to have to step in some way. So we talked about how maybe you've got somebody who's actually attending an appointment with your child, which can feel really dysregulating to a parent because we like control over everything that gets said. But if they're not stepping in that way, they're stepping in other ways. They're taking care of your kids when your other kids, right? When your sitter falls through, they have a key to your house because you had to stay an extra night at the hospital and you are in a rural area. And so when you go to the hospital, you're actually 4 or 5 hours away. I mean, when I worked at the Children's Hospital in Colorado, there really is a lot of rural area around Denver where that's the closest hospital by 6-7 hours, right? So, okay, mom goes up and stays with the kid who has chronic illness. Maybe there's another parent in the picture. Maybe there isn't. I mean, that's a lot of logistics to nail down. And so there has to be a lot of comfort, I think, with using your village and not feeling guilt around that. I think guilt and shame are really big driving emotions for parents in this situation. They feel guilty that their kid is ill. Why do they feel guilty that their kid is ill? Well, genetics, right? That's a thing that people feel guilty about. Well, they have it because of me, right? Or they feel guilty that, they weren't able to parent their child in a way that could have prevented it, right? Things that aren't true, but that people think. And so then if you've already got that guilt or shame, I mean, it could even be kind of that stronger, I actually feel ashamed that this is happening type of emotion. And then you feel guilt that you need to ask for help. and that you couldn't be strong enough to do it all on your own. I think if parents start to notice that they're having those sorts of thoughts and feelings, they really need to be thinking about finding their own potentially mental health support, somebody who can really hear them out in a way that maybe a friend can't, because, they already don't want to burden their friends anymore. And so I think therapy services can be really, really necessary for parents at various points during this process. They don't always write chronic illness. They don't always have to be in therapy, but sometimes it can help to do some right when you're learning about the diagnosis and everything feels really new, or when the challenges with your child exacerbate, or maybe they've just droned on for so long now that you're feeling really lost in it and swamped in it. But also, parents have to keep their own identity that is separate from the identity of the child. This is a big challenge when chronic illness is part of the picture, because the parent just says, okay, now my life is this. My life is healing this child. That can lead to dependencies between the child and the parent that are not going to be healthy. The parent needs to be their own person with their own identity and their own interest, and so does the child. And it can be really easy for that to get mixed and muddled in this context.
Yeah. Well, and because oftentimes it's not something that's short-lived, right? So the
Right.
of it being chronic is also that it lasts for probably their lifetime, or a long period of time. And so, it's like, I get the jumping in, right? Like, your child is diagnosed with cancer. You're like, okay, this is what we're doing. But you don't know how long that's going to be. And so when you lose yourself, then it can cause other trickle down effects of that, of like, you lose your identity because now you're this caregiver and that's all you know, or there's opportunities for lots more shame and guilt that are happening as secondary side effects to that. And so keeping your identity, asking for help. I love this idea of asking for help. I think I will admit that in my life, I was somebody who didn't ask for much help. And
Me too.
And then as life has gone on, I realized that, like, actually I need help. Like, I can't do this all on my own. And it's so much better, right? Like, it is, if 6 people are driving to the same event and they live close by to you and they can take your child, like,
Have them take your child.
Have them take your child, right? Like, even just in kids without chronic illness, right? But just thinking about how we can join together as a community. And I think creating that network, and even if it is, relatives that you do have, but you feel like you can't trust them, or they're not the right fit for you, that's okay, right? Looking for those people that you would define as those people that would support your family, and sharing with them what you're going through. And people ask a lot of times how they can help. And
and they really want to know something concrete.
Yes. And you're so right. When I had cancer, people would ask me all the time, what they could do to help support our family. And I think, it's hard for me to come up with something, because sometimes you don't know. But I think it's like, if you can lighten the burden just a little bit, that definitely helps. So driving kids places, dropping off food, or like running an errand, picking up stuff at the grocery store, like just coming to chat, right? Like, I think just those normal things of like, that's how people know they're important in your life, when they have a role or something that they can do. They want to help. And so allowing them in is not weakness, it's actually strength. I think asking for help is really strong, because
it's hard.
You have to kind of bear your soul of like what you need. And I think that is really brave. So I would say to any parents out there, do that.
Me too. And one way that even I have become more comfortable asking for help, because, I don't live in a city where I have access to any of my biological family other than, my husband and our kids. And I've been very uncomfortable asking for help, very, very uncomfortable, because, right, I'm like, oh, I have, this degree, and like, I should be competent, right? I shouldn't need help, all those things that, especially those of us who are trained in the mental health field, we know those statements are not helpful. They're the opposite of helpful, and they're not really even true, but we still hear them in our heads. And This sounds counterintuitive, especially we're talking about how busy all of these parents with kids with chronic illnesses are. But one thing that I think can help people who struggle to ask for help actually accept help is trying their hand in offering help to others and recognizing that it feels good to offer help to others and to carry that out and kind of really recognize that people get something good out of this. I'm not just taking from them, but also when you offer help to someone, when you say, hey, I'm over here and I noticed that your kid's at the same practice, let me just bring them by. We live 5 blocks away. That begets other people offering practical help to you. It's kind of like a pathway to a healthy back and forth sharing of resources situation. And I think that's really what community is. It's not just giving. It's not just taking. It's knowing each other well enough, being present enough in each other's lives that we just naturally kind of know and begin to understand the places of need and the points of intersection. And eventually it doesn't become asking for help all the time. It just becomes living in your community that's very connected and people are very aware of how to pitch in. So I think getting over sometimes some initial humps in that I need help type situation can kind of lead to better stability of access to a useful community.
Yeah. No, I totally agree with you. I think just recognizing our value and other people's value in our lives, it doesn't always have to be about taking. We like the give and take part, right? Or being able to receive that help actually is really good for everybody. So if you could talk to kids to change the topic just a little bit, you have a chronic illness. What would you want to say to them? What do you want them to know?
I think a big thing that I would want them to know is that they are so much more than any label that they've heard somebody use when they refer to them. Something I learned like probably in undergrad was that phrase that labels are sticky. They're sticky. Kids hear somebody say, this child is this child has that. And they put it on as like a piece of clothing that they wear around, right? And it's like, wow, you are so much more than that. And I also would encourage kids to get curious. God, I gave myself a thumbs up there. And to advocate for themselves, because I have talked with so many kids who know they have an illness, a disability, something like that. They know the label. And I'll ask them, how do you know? And they'll say, I heard somebody talking about it. So there's often a reluctance for providers and even parents to talk to kids about what the illness or the challenge actually is. There's an avoidance there, which then leads to false narratives. The child doesn't even really know what the diagnosis means. Or why it is that when they look at their, chart, because they see it up on the computer, right? You can see a lot of your medical stuff just as nurses and doctors are filing into the room. And so when they get to reading age, they can just look up and see it. And, so first I would want providers and parents to be a lot more open about like, hey, here's what we're going to get treatment for. Here's what this means. Here's what we mean when we say this. Because often when we explain it, it's a lot less scary than what's going on in the kid's mind. But since we're talking to kids right now, I would tell the kids, ask. There's really nothing about your medical treatment that you don't get to know about. Because it's your body, it's your experience. And if you have questions about it, or if you have fears that are challenging for you to share, you need to be able to get those questions answered. It is your right to have people talk with you about that. And so I spend a lot of time talking with kids about how to ask questions about what's happening to them.
I love that. I mean, we have to teach our kids how to advocate for ourselves.
Yeah.
It's not something that we are just, maybe we are born with it because babies do demand things, but they just know that they're getting their needs met, but they're maybe not probing to get like, why do I need this? Or what does that mean exactly? And so I do think that we have to be taught how to advocate for ourselves. So on that note, what would you say to parents? I think you've kind of alluded to some of those things, but what would you say specifically to parents with kids who have a chronic illness?
Yeah, I mean, it would be a very similar, keep those lines of communication with your child about what's going on very open. It is, parents want to protect kids. I think adults want to protect kids. We want to protect each other from bad news, from realities, from loss of innocence. I mean, that's a theme. That is a major theme that children who have chronic illness deal with, is like they learn far more quickly than other children have to learn that the world isn't necessarily fair. It isn't necessarily safe. They're learning those lessons. And if they're learning those lessons outside of the ability to really speak openly with adults about it, because the adults are worried that it will further harm the child to have open conversations about it, that's actually harder. And it is, I recognize, especially now as a parent, because a lot of the work that I did with kids with chronic illnesses, I didn't have kids yet. And so it was kind of a different frame of mind for me. But now that I do have kids, man, I really understand that desire to avoid those challenging conversations. But I mean, I really want parents to know that if they can regulate themselves and feel prepared in terms of the words that they may want to say if a child asks certain questions, or the themes that they really want to get across to their child, that they need to be willing to have those conversations. And after appointments, they need to be willing to look at their kid and say, how did that go for you? How did that feel? What questions do you have based on what happened today? Did you understand what Dr. So-and-so said? Asking that, making them feel like partners in this, especially because one day these kids with chronic illnesses, they're not going to be kids anymore. And it's not, they're going to have to take care of themselves. And so in many ways, we are training the child young to manage something that's going to continue to be a part of their lives. So again, those conversations are hard. Parents need to do them when they feel regulated, when they feel ready. And they might even consult with, a mental health professional or a medical professional about how to message to kids in ways that are honest and direct, but that aren't alarming or overwhelming. So saying to a kid after, a painful medical procedure, something like, oh, wasn't that so traumatizing? Or wasn't that the worst pain you've ever felt? That's probably not going to be helpful, because that might make the child's perception of what happened even increase above and beyond the pain they did experience. But, learning to just say, wow, there were a lot of procedures that you just went through. What were those like for you? Right. And letting them know that it's not too big for them to talk about, because it's hard for parents to see kids go through that as well. And so parents can put the walls up because they don't want to, after it's over, go think about it again. They just watch their child suffer a little bit. They don't want to talk about that again. But I think to a certain extent, parents need to let kids know that the lines of communication about that are always open, and that any way that the child felt during that is okay. Some kids after those big appointments feel a ton of relief because it's over. It wasn't as bad as they expected. Imagine how healing it would be for a parent to hear that, right? Like, yeah, mom, that was tough, but it wasn't as bad as last time, or it wasn't as bad as I expected. And just talking about it. You've got to talk about it. You can't pretend that any of this doesn't exist. The kids are seeing all of this firsthand, just like the adults are, and pretending to shelter them is not going to be effective.
Yeah, because I was going to say it's happening anyways, and kids are going to create the narrative. So they're going to make up a story. And a lot of times that's so much more confusing than what is actually happening. Right. I mean, it doesn't make what is happening suck less, but it does help them to understand what is happening and being able to communicate that calmly and in a way that's helpful for them to hear. You don't have to have all the right words, right? But letting them know that you're on their team and you're doing this together. And, we have all these other support people, if you do, in your lives to help us through this. And Something that I think is helpful is like, even if you're in that appointment, the doctor says something and you're like, did you understand what Dr. Smith just said?
Mm-hmm.
Could you like, can you tell me back in your own words what they said? Like if it's something that's like a big deal, right? And then that way, you know that they understood. And then you still have the practitioner, the physician there to say like, okay, are we on, like, did we get that right? Because sometimes there's things where I know that parents get confused because
they're stressed when they're in there.
Yeah. So much medical language. So like they're trying to think like, how am I going to work around this? Like, will I be able to go to work this month? Whatever it is, right? Like, how will we afford this? Those different things, or how will my kid handle this? They're going to miss school, got to contact the school, and they've stopped listening to what they've said. And so I think it's helpful to make sure your kid is understanding that, because they're hearing the conversation. They're there, right? Like right in front of you. And so I think that is an important piece for sure.
Well, and parents, they want it. We talk sometimes in this group that I work with about basic assumptions that we as providers should have about all parents, like until proven wrong, right? You need to have these basic assumptions about parents. And one of them is that parents absolutely want what's best for their child all the time. And in fact, parents are always, I think, trying to show their medical team or their mental health team just how much they're showing up for their kid. But sometimes that striving to be the good parent actually gets in the way of some of these emotionally important conversations, and or the parent's willingness to ask for that further clarification, right? Because if they keep having to ask, or if they're showing that they don't quite get what the doctor is saying, well, how does that reflect on me as a parent, that I don't understand this, that I don't have the skills or what have you? But no, actually, that is the skill. The skill that you need to be a good advocate for your kid in this situation is the ability to say, help me out here. We're not on the same page yet. And my kid's not on the same page as you yet either. And slowing people down, that's good parenting. That's not a sign of weakness or a sign that you don't have it together enough to know what's going on.
I love that. Thank you for putting that out there, because I do often think that sometimes parents will say like, yes to that. And then they come to me and say, okay, so our doctor said this, what does that mean? And it, and so they're looking for that information, and it makes sense. Sometimes in the moment you thought you understood, but then you took time to process and it's different. But if in the moment you don't understand, please ask. Like I tell families, like, please ask me. Like if I've said something and it doesn't make sense, like ask me for further clarification. Or even kids, like when they say like, what does that mean? I'm like, thank you so much for asking. Like, I really appreciate that you said you didn't understand what that word meant, or you didn't understand what I was asking you, or then I can ask you in another way. That's perfect. Absolutely. Okay. So what do you want parents to take away from this conversation? We've talked about a lot of things in this conversation, and a lot of things that are just like so hard.
I was just reflecting on that. I think one of that we haven't focused on the hope a whole lot, which
let's
like a trauma focused specialist and somebody who works with kids with chronic illnesses, like we know how important hope is. We also know that there's a lot of hope. So when we look, at research, sure, having a chronic illness can put children at risk for a variety of challenges. It increases day-to-day stressors that people face. We can't hide from that. But knowledge is power. And we also know that when kids go through challenging situations, be they stressful, traumatic, people get to define that for themselves, right? I don't get to define for somebody else what's stressful versus traumatic for them. But the research on the buffering effects of relationships on these life experiences is really quite strong. We know that when kids go through stressors or outright major traumas, that if they go through those in the presence of safe, stable, nurturing relationships, and then when that kind of crisis moment has passed, they get to continue to rely on those safe, stable, available, nurturing relationships. the potential negative effects really get diluted. I mean, it really makes it such that you are unlikely to have very different challenges from other kids despite having gone through that negative situation. I mean, these safe, stable, nurturing relationships can really make it such that kids can not only be resilient, but sometimes show growth after these challenging situations. You know, a lot of kids, when they experience hardships or stressors early on, actually have opportunities to build skills and worldviews and perspectives that other kids don't get to build. I mean, think about the empathy that can come from this. Think about the self-advocacy. Think about the problem solving, the persistence. I mean, these are all the positive attributes that if we are really there walking with kids through these experiences, they can actually develop strengths that will carry them forward in beautiful ways. Some of my favorite people in this world have siblings with disabilities, right? They learned as a child just how important it is to show up for others, and just how important it is to be a team player, and just how fragile life is, right? And these are people who, you know, their perspective, I just want to carry with me always. And so it's not all bad. We have a lot of work to do to prevent the potential negative effects, but there can be positive things that come from having this be a part of your life if you're open to it.
Yeah, I love that. Well, and it makes me think of, I interviewed a mom who has a child with Down syndrome, and she's an adult now, and she was talking about how proud she is of her kids and how lovely of humans they have become. And even though there were moments that were not beautiful, they were really frustrating and stressful and hard, that the people that her kids have become are lovely, and that she's so proud of who they are. And I think, you know, the key to that in my mind is communication, talking with all of your kids, right? So like opening this door and saying like, how do you feel about this? So, you know, your brother's in the hospital a lot, or is taking a lot of time. How is this impacting you? And it's hard to hear that piece for your kid to be like, well, it really stinks, and I feel like you're never home. And you're like, I mean, if that's true, it's like, you're right.
Yeah, it's hard.
Right? Like this is true. I am not as available I want to be, but that is not making me physically here. And and if you feel a feeling, like to say like, it hurts me too, right? Like I really do want to be here, and I'm sorry, and I'm trying, what could we do that would make this feel better for you? And that might be like playing cards before bed every once in a while. It doesn't have to be all the time.
Yeah.
Maybe it's snuggling, or maybe it's watching a Christmas movie, even though it's not Christmas. Maybe it's whatever it is, right? Like those are the moments that really do matter. And maybe it's like if you're gone, it's like seeing the kids off to school via FaceTime, like being able to just like physically see them. And there's a million ideas, right? Like there's a lot of different things, but I think kids know what they need a lot of times. And if we allow them the opportunity to convey that to us, even though it's hard, then we can do something about it to make this an experience that we're going through. Like this is just a season, hopefully, of life where things are harder. And that doesn't mean that the illness is not necessarily going away, but I do find that we ebb and flow in things of like, it may be more hard at one particular moment, and then we kind of like feel like we got our routine together, like, you know, we're in a good holding pattern or space, or like things are getting better. And so just like having that language of like, this is like a hard season, right? Or like, it's just a hard time right now. Like, here's what the plan is. So like giving them the schedule too of like, this is what this week's going to look like, right? Can I coordinate a play date with somebody? Can I, whatever it is, to help them in that place too. If there's a cheerleading competition they have and you would miss it, it's like, can so-and-so's mom FaceTime me so that I can see it, right? Like just making sure that you're showing up and talking to all of the kids, right, about all of these different things. And I think that communication piece is just so critical to navigate.
It is. And the emotional validation, because right, you've mentioned all of these beautiful practical supports and ways that parents can connect and help. But when I talk to older youth who, had siblings with chronic illnesses, and I'll ask them, what was hardest for you? They will often say, nobody acknowledged it, right? Like it was just expected that I knew that it was all about my sibling. Mm-hmm. And so the emotional validation and the looking somebody in the eye and saying, I know this isn't fair to you either. And I know you're making sacrifices. Mm-hmm. And yes, being open to just hear the painful ways that they will share with you that this has impacted their life, it can make a huge difference. When people feel seen, they feel safer and they feel less resentment. Mm-hmm. And so, being willing to engage that emotionally and not avoid it is so key. And then that's the only way you can get to this place of, well, what can we practically do, right? Mm-hmm. Like, is there any of this stuff that we can actually fix? Because a lot of it, I think, can be fixable if there's good communication.
Yeah, absolutely. Well, thank you so much for your time today. This has been such a great conversation. I so appreciate it, Erin.
Yes, I've enjoyed it. Thank you for having me.
Thanks again, Erin. That was such an awesome conversation. We so appreciate your time. I hope that this message has been helpful for you and is helping you to find the hope and to know how to manage it, and also understanding the challenges both for you and your kids, as well as other people in our community that are going through this. With that, I will say thank you so much for your time today. Please rate and subscribe to our show. Follow us on Facebook, Instagram, YouTube, and TikTok, and keep the emails coming with future topic show suggestions to accidentalexperts@gmail.com. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.